Welcome back to Breakfast Television. Back to talk about seeing your family doctor and making sure you are well prepared when you see your family doctor. Of course, joined by Dr. Zach. He is back, ER physician at the MUHC. Dr. Zach, welcome back to the show. Great to have you here. Let's talk about, first of all, the amount of time that we're seeing patients being able to spend with their family doctor. What's the average we're looking at now?
It's decreasing. I mean, definitely when they look at the time now compared to, say, 20 years ago, it's definitely less. Now we're looking at maximum 15 minutes, but most of the time less. Most of the time we're looking at more like 13 minutes. And, I mean, patients feel that. Doctors feel it too. I mean, doctors feel the pressure to see, you know, there's so many people without a doctor.
Right.
And so doctors know that, and patients know that too. And so the time that we spend together is quite precious. And that's why I thought it was worth talking about, you know, how to get the most out of that very limited time that we have together.
Exactly. Well, let's do that. The first thing you say is plan ahead, and you're saying that, like, really pick one or two concerns is probably the most important thing, right?
Yes. I mean, you have, you know, people have their agenda, and the doctor's agenda may be different, right? The doctor knows, oh, you know, you're a, whatever, 55-year-old male, we should be screening you for this and this and this. But you may have a couple of worries that are on your mind that you've been thinking about maybe for a few months, and you want to get those out there. And so, you know, in the limited amount of time with all that pressure, you may forget. And so that's why one of the things we can talk about after is lists. But you want to think ahead, you know, really what are the most important things to you?
Right.
You're not going to be able to cover 50 separate systems. But if you have two things that are really of concern to you, you can actually, you can look them up, you can do some research, and you can also think of sort of salient questions about them. And you can also think of what's specific about them. So if it's a pain, for example, how long has it been going on? What brings it on? What makes it better? Just certain things about it that the doctor will probably ask you.
Yeah, and you say, you know, really prepare specific questions is one, and that goes into that. You know, if you have those two concerns, you should, have 2 or 3 questions prepared for each of those concerns, I imagine?
Yeah, I think, yeah, if you have, ideally you have specific questions, because if you have, you know, if it's very general, you know, what takes time is explanation, which is fine. That's part of the doctor's job.
Right.
But if you're able to find some of that, like if you have a diagnosis that you know already, but you have specific questions, then you can look it up. You can go to a reputable site and you can look up information, and then you can ask specific questions. If you really have no idea what it is, you know, the internet, we've talked about this, you know, it's a dangerous place. If you just go, you know, back pain, it could be something, it'll give you anything. But if you have a specific diagnosis that you know, then you can spend more time researching it, and then you may have 1 or 2 things that you don't understand. And also your doctor will know about it, but also has experience. So that's another thing that you can call upon. You know, what's your experience? What has worked well for your other patients?
Right. Let's talk about those lists. You mentioned it a little bit earlier on. What should be on that list exactly?
So, you know, definitely, it's intimidating. If you come with a list of 50 different things to your doctor, the doctor will be like, oh, you know, oh boy, I'm really in trouble. However, like I said, you may forget, you know, some of the things that you wanted to bring up. And so one of the things is if you have a few salient questions, to have that on the list, but also past stuff. This is especially, you know, here where you may not have a family doctor. Ideally, your family doctor knows your past history. But if he or she doesn't, it's very important to have a list of your medications. You know, your doctor needs to know what medications you're on. A list of significant past medical and surgical history.
I got caught on that. I just went in for, you know, minor surgery recently. But they want you to list all the surgeries that you've had over the years. I couldn't remember when, I couldn't remember, you know, I forgot a couple of them. And again, that goes to even with a specialist, if you're not seeing your family doctor and you're seeing a specialist in that case, right?
Yeah, and it's better now. We have this DSQ, the Dossier de Santé Québec, so we have some access to radiology, so imaging tests, we have medications we can get, and lab tests, but we don't have the doctor's notes, you know, so that's a very important part.
Another thing on your list, allergies, you mentioned as well, if you have any allergies.
Yes, thank you. And another thing I mentioned, which I forgot to mention earlier, is just on average, women doctors do spend more time with their patients than male doctors. I thought that was interesting.
I have a female doctor. Okay,
well,
I'm glad to hear that. Let's talk about, I mean, you're an ER physician. Let's talk about going to the ER. What should you be prepared for when you visit emergency?
Well, so yeah, going to the ER, if you have an option not to because it's something minor,
of course,
then ideally you don't go to the ER. If it's something very significant, or you're very worried about it and there's no other option, you have to go to the emergency department. I certainly don't fault people for going to the emergency department, even for minor things, if they have no other option. But you have to keep in mind that it's, you may wait if it's not a very major thing. There's something called the Canadian Triage and Acuity Score, which triage nurses use to decide who gets seen. And so number one is, you know, if your heart stops, you know, that needs to be seen immediately, right?
Yeah.
And it goes from 1 to 5, and 5 are things that can wait up to a couple of hours. Unfortunately, they typically wait longer because they keep getting bumped by the, by the more acute things. But, whatever, a stub toe, for example, if you're worried about it, and if it's worth it to you to wait for a long time, then...
And it's a long time. Like, we're talking 6, 8, sometimes 10, 12 hours, depending on how busy it is. We've run out of time, but I just wanted to go over a couple. Ambulance will speed things up is one of the things you sent along. If you're not well and you don't feel that you can drive, of course, you can call the ambulance. Consider calling a health line before you go to emergency, and try to go where you're known, which is an important factor as well, because they'll have some of that history you spoke about a little bit earlier.
Absolutely.
Dr. Zach, always a pleasure having you on the show. Pressure.
Thank you.
There's no pressure here.
No pressure.
But there is pressure for you to go to our blog, because btmontreal.ca/blogs has all the information, everything that we've talked about and more. You're watching Breakfast Television here on City.